Okay, so let's start our tour at the very top, with the two nerves that actually come from the cerebrum itself. These two are purely sensory, and they're in charge of two of our most fundamental senses. First up is cranial nerve 1, the olfactory nerve. This one is 100% dedicated to your sense of smell. So if there's damage here, the sign is pretty straightforward. You can't smell as well, or you can't smell at all. Then we have its partner, cranial nerve 2, the optic nerve. Its job is to take everything your retina sees and shoot that information straight to your brain. Any damage along this nerve can lead to vision loss, either partial or complete. So right off the bat, we have two nerves for two vital senses. All right, let's move down a bit to our next stop, the midbrain and the pons. And trust me, this is where things start to get really dynamic. We're about to meet a group of nerves that are the absolute masters of movement and sensation, especially for your eyes and your face. Okay, meet the powerhouse of eye movement, cranial nerve 3, the oculomotor nerve. This nerve is a serious multitasker. It handles most of your eye movements, it lifts your eyelid to keep your eye open, and it controls your pupil size. But here's the part you really need to know for clinicals, the red flags. If this nerve gets compressed or damaged, you'll see a drooping eyelid, a pupil that's dilated and won't react to light, and the eye itself will actually drift down and out. Why? Because the other eye muscles are now pulling without any opposition. Now, the oculomotor nerve is the big boss, but it doesn't work alone. It's got two specialists helping out. First is cranial nerve 4, the trochlear nerve. It has one very specific job: control the superior oblique muscle, which moves the eye downward and inward. Then you have cranial nerve 6, the abducens. Its only job is to control the lateral rectus muscle, which moves the eye outward. So if that nerve is damaged, the eye can't look to the side and it'll actually drift in toward the nose. And this little chart just lays out the teamwork perfectly. So think of it like this. Cranial nerve V pulls the eye out. Cranial nerve IV pulls it down and in. And cranial nerve 3, it does pretty much everything else. Getting this division of labor down is absolutely key for figuring out which nerve is in trouble when a patient comes in with double vision. Okay, now let's talk about the giant of the face, cranial nerve V, the trigeminal nerve. It's called trigeminal because, you guessed it, it has 3 major branches. The first 2 branches, V1 and V2, are all about sensation. They let you feel a touch on your forehead, your eyes, your cheeks. But that third branch, V3, is special. It handles sensation for your lower jaw. And it's a motor nerve that controls the powerful muscles you use for chewing. So a problem here could mean facial numbness or serious trouble chewing your food. So if the trigeminal nerve is all about feeling the face, cranial nerve 8, the facial nerve, is all about moving it. This nerve controls every single one of your facial expressions, smiling, frowning, you name it. But it's got other gigs too. It handles taste for the front part of your tongue, and it tells your tear ducts and salivary glands to get to work. Clinically, this one is huge. A sudden facial droop or paralysis, like in Bell's palsy, points directly to an issue with cranial nerve 8. All right, next up, we have cranial nerve 8, the vestibulocochlear nerve. Its name pretty much tells you exactly what it does. The cochlear part is for hearing. It transmits sound. The vestibular part is for your sense of balance and knowing where you are in space. So when this nerve is damaged, you can see hearing loss, sure, but you also see things like severe dizziness, vertigo, and nystagmus, those weird, jerky eye movements. It's 2 different functions all wrapped up in one critical nerve. And that brings us to our final stop on this tour, the medulla oblongata. The nerves that come from here are absolutely vital. They control essential functions like swallowing and speaking, and they even reach down into the neck and shoulders. So let's break down cranial nerve IX, the glossopharyngeal nerve. Glosso means tongue, and pharyngeal refers to the throat. So it gives you taste on the back of your tongue, it helps with swallowing, and get this, it has these little sensors in your carotid artery that monitor your blood pressure and blood gases. So if your patient has trouble swallowing or their gag reflex is gone, your brain should immediately be thinking about cranial nerve IX. And now for the rock star of the cranial nerves, cranial nerve X. The vagus nerve. Vagus actually means wanderer, and that is exactly what this nerve does. It's the only one that leaves the head and neck, wandering all the way down to manage the parasympathetic functions of the heart, lungs, and most of your digestive system. It's also critical for speaking and swallowing. Damage here can cause a hoarse voice or trouble swallowing, and if both vagus nerves are damaged, it's often fatal.
We are at the end of the line. We have cranial nerve 11, the accessory nerve, which is pure motor. It gives you the power to turn your head and shrug your shoulders. And finally, cranial nerve 12, the hypoglossal nerve, which controls all the intricate movements of your tongue. The clinical tests for these two are so direct. Can the patient shrug against your hands? Can they turn their head against resistance? When they stick their tongue out, does it point straight or does it deviate to one side? Super easy to test, and the results tell you exactly what you need to know.
Okay, that was a whirlwind tour, I know. So the big question is, how on earth are you supposed to remember all of that, right? Especially for your exams. Well, this next part of our study guide is all about giving you some seriously powerful memory anchors to lock all this information in your brain.
First, let's tackle the names and their order. Here's a classic mnemonic that has saved countless students, and trust me, it works. Just remember this phrase. Ooh, 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 to touch and feel very good velvet, ah, heaven. The first letter of each of those words gives you the first letter of each cranial nerve in perfect order from 1 to 12. But knowing the names is only half the battle, right? You gotta know what they do. Are they sensory, motor, or both? Well, there's a mnemonic for that too. Some say marry money, but my brother says big brains matter more. Again, the first letter of each word tells you the function of the nerve in order. S for sensory, M for motor, and B for both. It is an unbelievably effective way to remember this stuff on the fly.
Okay, you've got the anatomy, you've got the memory tricks. Now for the most important part, putting it all together. This is where knowledge turns into clinical wisdom, the kind of thinking you'll need for the NCLEX, and more importantly, for your actual practice.
So when we talk about clinical judgment, what are the absolute non-negotiable red flags you need to have burned into your brain? Here they are. You see a sudden pupil change, like one that's dilated and fixed? You better be thinking cranial nerve 3 compression. That's a neurologic emergency. A sudden facial droop? That's cranial nerve 7, and you have to rule out a stroke. Stat. Your patient has trouble swallowing? That's a sign of a problem with I9 or 10, and it puts them at a huge risk for aspiration. And any weird eye movements? That helps you zero right in on nerves 3, 4, or 6.
All right, to pull all of this together, let's finish with a quick what would you do next scenario. Your patient shows up with a sudden droop on one side of their face. They can't fully close their left eye, and they mention that food is starting to taste strange. So think back on everything we just covered, putting all those clues together, the facial movement, the eye closing, the sense of taste. Which cranial nerve should be at the very top of your assessment list? This is exactly how you'll be using this knowledge every single